Assalamu alaikum. Let's discuss about a very complex topic. For me, it's subclavian steal syndrome. What happens in the subclavian steal syndrome? We know that the vertebral artery, the right and the left vertebral artery, fuse to form basilar artery, and a basilar artery, the first branch of the basilar artery is ICA, anterior inferior cerebral artery. There is pontine branches, there is superior cerebellar artery and posterior cerebral artery. So it starts giving um, supply to the upwards towards the brain. Okay, what happens in the subclavian steal syndrome? If there is stenosis or occlusion, if there is stenosis or occlusion, what happens in then the vertebral artery? Usually stenosis happen in the left side, it is most common. Then the supply, instead of going above through the basilar artery, it starts to going to the opposite direction. So the supply starts to going to the opposite direction where the stenosis is happened. So there is stenosis area. So in here the blood supply is enhanced. So that is a problem happens in subclavian steal syndrome. Look at this question first. A 68-year-old man comes to the emergency department. Why? Due to severe dizziness while playing an hour ago. He says that he had a spinning sensation accompanied by nausea and vomiting. The symptoms have now subsided. The patient has had a brief episodes of dizziness in the past, especially not performing vigorous work at his arms. He has also experienced heaviness and fatigue on the left arm. The patient has a history of hypertension, hyperlipidemia, blood pressure is 140/90 in the right arm and 100/74 on the left arm in the stenotic arm. Pulse is 82, regular asystolic bruise found on the base of the neck just above the clavicle on the left side. So where there is stenosis, stenotic in the stenotic area, there is decreased blood pressure. There is presence of systolic bruit. Cardiac auscultation discloses a fourth heart sound that indicates left ventricular hypertrophy, fourth heart sound, uncontrolled hypertension. There is no extremity weakness or sensory loss. Which of the following is most likely cause? It may be due to subclavian artery stenosis. This may be due to subclavian artery stenosis. This is the subclavian artery and stenosis in here happened. Okay, so this patient likely has subclavian steal syndrome due to severe atherosclerosis of the left subclavian artery. Due to atherosclerosis of the left subclavian artery, proximal to the origin of the vertebral artery, proximal to the origin of the vertebral artery. Significant stenosis significant stenosis or occlusion leads to decreased pressure in the distal subclavian artery and reversal of the blood flow in the ipsilateral vertebral artery. So Significant stenosis or occlusion leads to decreased pressure in the distal subclavian artery. So this decreased pressure in the distal subclavian artery, and there is reversal of the flow in the ipsilateral vertebral artery. The left subclavian artery is most commonly affected than the right, likely to the sharper curvature and a more turbulent blood flow leading to atherosclerosis. Most patients with subclavian artery stenosis is asymptomatic. When symptomatic, patients commonly have symptoms of ischemia in the upper extremity. Ischemia in the upper extremity, there will be pain, fatigue, paresthesia, and less commonly patients with concurrent atherosclerosis of the circle of the Willis may develop symptoms of the vertebrovascular ischemia, dizziness, ataxia, disequilibrium. Exercising the affected extremity causes arterial vasodilatation and a further lowering of the distal pressure, which may exacerbate vertebrovascular symptoms. Physical examination often demonstrate a lower brachial systolic pressure more than 15 millimeter of mercury in the affected arm. Where there is subclavian artery stenosis, there is significantly lower blood pressure and a systolic bruit in the supraclavicular fossa on the affected site. A fourth heart sound may be seen due to left ventricular hypertrophy from systemic hypertension. And diagnosis is typically made by Doppler ultrasound or MR angiography. Treatment involves lifestyle modification, lipid lowering intervention, smoking cessation, and sometimes stent placement. So that is the subclavian still syndrome. And in vertebral artery stenosis, it can cause symptoms of dizziness, disequilibrium, but ischemia or blood pressure difference in the upper extremity is not expected. So that is all about uh, subclavian still syndrome. Hope you enjoyed.